Alondra, and this is Therapeutic Exercise. Today, me and my pal JD are going to talk about yoga and how it relates to physical therapy and total body control.
The Oxford Dictionary defines yoga as a Hindu spiritual and aesthetic discipline, a part of which including breath control, simple meditation, the adoption of specific bodily postures, and is widely practiced for health and relaxation. Now, that's a lot of words to talk about the three main parts of yoga that has to do with physical therapy, and those are physical postures and how we're able to control our body postures at different phases of movement, breathing techniques and how we take in oxygen and release carbon dioxide, and when we do which on which part of the movement in the workout, and meditation. We've all learned how a healthy mind is just as important in getting a person back to par as the physical body is. The benefits of yoga are there's four main benefits of yoga. The first one being muscle responses. It encompasses the three main portions of muscle contractions. Plenty of concentric loading for shortening the muscles, and that's going to be the concentric portion. The eccentric portion is the elongation of the muscles and releasing them with gravity, but controlling that portion, that'll be the strongest portion. And then the isometric holds, there's plenty of isometric holds in yoga. So you get to hit all three in yoga when you're doing this practice. Recovery is increased vascularity and increased blood flow. The more blood flow, the more recovery. We've all learned that about in modalities and therapeutic exercises. Stretching, obviously when you think of yoga, you probably think of stretching only. And that's not all it is. That is a big part of it. It definitely beats that 6-second window of getting over the GTOs. Typically the stretches are held about 10 to 20 seconds, and they go to the point of tissue resistance and try to take it a little bit farther. And then spiritual and breathing and movement. You want to release upon elongation in the hard part of the movement and inhale on the relaxation of the movement. And learning how to do that in yoga can help you right into the real world.
A lot of you may want to know, but I'll go ahead and answer before you ask, what population best benefits from yoga? Well, guess what? If it's one thing we can all agree on, I think it's safe to say we all can agree that we have tight muscles. Well, guess what? If you have tight muscles, you can benefit from yoga. Also, people who have to do movements in multi-planar directions, which we all do in everyday life, can benefit from yoga. People who stress or have mental issues, and I think it's safe to say we're all pretty stressed right now. Guess what? We can benefit from yoga. People who need respiratory training can benefit from yoga as well, because as JD mentioned earlier, when we perform yoga through these exercises, we also like to work on breathing techniques. This can incorporate respiratory training. Also, if you want to do resistance training, but for some reason it's contraindicated for you, yoga is also a great thing to do when you can't do resistance training, because yoga just does not focus on stretching. It has some resistance aspect to it as well, without using the heavy lifting weights that you usually see in the gym. Last goal is when the treatment requires muscle elongation. If a patient comes in and the goal of treatment is to make those patients' muscles elongated more, to increase range of motion and mobility, yep, they can benefit from yoga. The next pose we'll be performing is the high lunge and twist. JD, I would like for you to get into a low lunge, please. And twist your body so that way you're facing me. This is giving him a stretch on his left hip flexor and also his left trunk rotator. I would like him to hold this pose for 10 seconds. After 10 seconds, I would like him to come back up into a neutral position and regain balance. And then we'll switch sides. Now, can you all tell me what he's stretching now? And relax. Okay, class. Today, the first pose we're going to do is called the tree pose. What I would like JD to do is to flex his hip. Then externally rotate. And then place his foot on the inner thigh. and hold. As he performs this exercise, I would tell him to breathe in and out slowly, working on that breathing control. He would hold this for about 30 seconds.
For this next pose, I'm going to have Alondra get down on all fours to begin with. And then she's going to slowly poke her belly button toward the floor. For us PTAs, we know this is anterior pelvic tilt, stretching the trunk flexors. And then next, I want her to suck in that belly and try to arch her back towards the ceiling, putting it into her posterior pelvic tilt, stretching the back extensors. And repeat. Breathing into the nose and out through the mouth, exhaling on the hard portions of the exercise. This is also something we can do to find a neutral spine in a patient if that is something that is a problem. And pause. And for this next pose, we're going to have Alondra assume the prone position. And perform a prone press up with her legs extended, up away from the floor, looking at the ceiling. And hold. Again, this would be an anterior pelvic tilt, stretching the trunk flexors. Breathe in and out. And pause. Today we have a 40-year-old female receptionist. She's coming to the clinic complaining of upper back pain. This is due to a slouched upper back posture, which is causing excessive thoracic kyphosis. Also, we did a Thomas test on both of her lower extremities, which was positive, so we know she has bilateral hip tightness. Also, due to COVID-19, her office has been let off by half, which is increasing her workload by double, increasing her stress as well. We have built her a yoga program to hopefully help her physical ailments and her mental state as well. Starting off with the cat-cow. Alondra come to all fours and sink that stomach to the floor and then arch it to the ceiling. And going back and forth. We'll also use this movement to find her neutral spine, which will help her into her posture and her desk as well. A few more seconds. Next, moving on to the cobra pose, Alondra will extend her legs out, going to prone and prone press up, pushing her shoulders back, stretching her trunk flexors. The patient may reset and restart this position if she so chooses. Moving on to the deep lunge. Alondra will come up, put her right foot out, and lean into her right foot. This is going to work on her hip flexor tightness that she has. And switch. And moving on to the dancer, also for her tight hip flexors. The patient will come to standing. She will grab her foot with her hand and then arch her back, looking up to the ceiling. Getting a really good stretch into that left hip flexor. This one we will hold for about 30 seconds and switch. Also, this will be a great balance workout. And pause. Moving on to the Warrior Way 1. The patient will assume a lunge position. Lean into her lunge, extend her hands to the sky, look straight up, and lean back. Really focusing on also still stretching that left hip flexor, but also pulling those scapulas back to work on her posture. And switch. And moving into our last movement, the cat-cow, the touch toes. Patient will mean simply just lean down and touch her toes. Focusing on stretching her hamstrings, which are also tight due to sitting in a static position at a desk at work. And pause. Let's check our patient's posture. Oh, she's completely healed. Thank you for coming.